Hey, yo, what's up? Welcome to the latest episode of the number one podcast for Black parents. It is the Black People Parenting Podcast. Of course, you know me. I'm your host, Dion, also known as the Glad Dad. And as I always say, once a month we have these really, really great conversations, and we have these conversations pertaining to health. Last month we had a really great conversation about Black men and Black men's health. This month is going to be something special because I got three melanated queens taking the stage with me today, and I'm just so happy to be amongst all of this greatness of Black women. I'm so happy to be here. So on the episode today, we're talking about Black moms and maternal health, and I think this is a very important conversation in the context of some of the things that we talk about monthly, just because I feel like it's one of those conversations that need to be had. I feel like it's important to talk about Black moms and to talk about some of the disparities in the healthcare system and some of the just biases that are happening and some of the things that are occurring in the healthcare system, particularly for and around Black moms and Black women. I think it's important that we listen to Black women. I think it's important that we hear them out and just make sure that their voice is being heard. So I always want to be an advocate for that and for those things. So with all that being said, let me introduce the one and only, the incomparable Dr. Bambi Gaddis. Hello, Dr. G. You're on mute, Dr. G. You're on mute. You're on mute.
I'm sorry. I said, wow, I'm blushing. Okay, so let me just note I am one of several national faith ambassadors. We came together some years ago, fortunately, as we were attempting to address the COVID epidemic. As time has transpired and we have gotten a handle to some degree on COVID, um, although it is still around and well, we have refocused to an HIV lens. And so part of our mission and why I'm grateful to be collaborating with Mr. Chavis is that not only is he a leader in the Black Parenting Network, but he has been instrumental in bringing a Black male voice to things that, as you can see right here, transition across gender and people's identities. And so to have him host this particular session is important. This is not just for women of childbearing age. It is for women in general. I am no longer that. As a soon to be 68-year-old woman, I am way past that, but there's still relevance in it for me because I have granddaughters. I have a great granddaughter. I have women that I love who are childbearing age. And I'll say in closure, this whole conversation about the stigma of HIV, and somehow the community believes that women who find themselves testing positive are no longer capable, nor should they have children. And so there's a whole element of this conversation that deals with women with health disparities and why women living with HIV are having HIV negative babies every single day because of biological science. And so that's
Mm.
why I think this conversation is so relevant, and I appreciate being invited.
Well, thank you, Dr. G. Next up on the panel is Deidre McIntyre. Hello, Mrs. McIntyre. How are you?
Hi, just Deidre, please. I'm
Just Deidre. I'm
wonderful,
sorry.
Deidre McIntyre.
I like to
Professionally,
pretend to keep things formal around here, but it's really not that formal.
okay, then I need to let me sit up straight. I need to go put some lip gloss on. Professionally, I am not in the healthcare field. I am in construction project management, but I'm here today, seated before you as a certified doula. And I became certified in becoming a doula because of the need to support families and
And
Black
could you tell
families.
us what that is
So
for?
a doula is just that. It is a person who supports someone. There are birth doulas, there are postpartum doulas, there are death doulas, there are abortion doulas, but it is a person who actually supports someone um, the term historically is a woman who supports other women, but we have seen a rise in people who identify as men as doulas. And so that is the basic premise of doulaship. It is supporting families, it is supporting that birthing person, um, either before, during, or after birth, or again, during life crises, or just in general. So
Mhm.
it is a support. It is, I don't like to say this, but it is an unregulated field, meaning that you do become certified, but as far as regulations as how you do your work, there's not many of those. So um, I became a doula to, again, for advocacy. Black maternal health has always been something that has been a top of mind for me. I am a birth mother of 3 and a bonus mother of 1. And although my experiences were what we would say good, in retrospect, they could have been better if I had the knowledge that doulas provide to families and their support system. So
Mm.
I'm here just again invited by Mr. Chavis. Thank you, to have a wonderful conversation of how we continue to build advocacy. One, because it's not just us who needs to do the work. The Black maternal health crisis is a crisis. We are in a serious crisis now, and so how do we support each other? And I also have a strong interest in supporting those who are medical doctors and midwives who are Black and Brown, because we are seeing a lot more of our professionals leaving the field because they don't have the support that they need. So it's becoming a real problem. And so how do we come together? How do we continue these conversations to ensure that we're protecting our community, our bodies, our, Black women, we birth, um and we nourish, and we support, and so we need to be here. So how do we continue to be here? And
Mhm.
so thank you so much for the platform.
Yeah, and it's funny you said something. I was talking to my mom the other day. My mom worked in the healthcare field for over 30 years, and she was telling me how a lot of Black doctors are leaving the profession. So at some point, I want to dive not in this conversation, but at some point, I want to have a deeper conversation, Dr. G. Maybe there's something that we can talk about offline about how we can start talking about these conversations about why there's so many Black and Brown doctors who are actually leaving um, the medical field. But last, certainly not least on the panel is the big speaker, Speak Up Dana, Dana Duckworth. Hello, ma'am. Please tell us a little bit about yourself.
Hello, and thank you so much for having me. I am Dana Duckworth, aka the Big Speaker or Speak Up Dana. I am a DEI practitioner, podcast host, and public speaker. And that's not important. The real reason I'm here is because I'm a Black woman and I am the mother of 15-year-old twin boys. So my lived experience can definitely share in this conversation. I'm also an advocate for inclusive spaces, equitable spaces, specifically in the corporate atmosphere. And for me, I just think it's funny how healthcare is even tied to an employer. And that's a whole other conversation there. But that is what I hope to bring to this conversation that we're going to be having today. Also, mental health and just health and wellness of Black women is something that I prioritize in my own life. I'm very open about my struggles with anxiety, depression, and my diagnosis with ADHD 3 years ago. So I think that we can have a really well-rounded conversation about the need for more advocacy, more just see us when it comes to that healthcare field. I had my children when I was 20. There's so many things I did not know then, so many people that could have lended their experience and their expertise to me and really made that a much easier process as a very young woman, having not one but 2 children. So hopefully through this conversation, we support someone else in having a better experience than maybe we had.
Absolutely. So, Deidre, I want to kind of toss the ball into your court, and I want you to help me out. Help me understand some of the health disparities that are present right now in healthcare, and how are they uniquely affecting Black women's experiences in both childcare and just like the overall healthcare. I'm somebody, I'll say this, as a man, as a Black man, all of my healthcare professionals are Black women, right? I don't let anybody else take care of me in any capacity health-wise other than Black women, right? My dentist, my therapist, everybody. If I went to the eye doctor, my optometrist would be a Black woman, but I don't go to the eye doctor. That's a different story.
Right?
Everything, all cared for by Black women, right? So I want to talk about
part of another whole conversation.
What is that, Dr. G?
No, I just think that there's a rationale for that. No, there's a rationale. I think it's the rationale for discussion.
Right, absolutely. So, Deidre, let's talk about some of these disparities that are uniquely affecting Black women in childbirth and in overall healthcare. So, as a Black woman, like, what are the things that you have seen and experienced in terms of, you know, just kind of the differences in the way that Black women are treated when it comes to their healthcare?
So when we think about it, we can think about generally the social determinants of health, right? And so when we think about, you know, we hear the stories of Black women receiving less pain medication. We hear the stories of Black women basically being ignored. And on the very high level, that is true. That is what I have seen as a doula. Again, but the other part of it that it happens way before then is the lack of knowledge. Black women aren't given the opportunities to know or given the information that I feel other people are given about the birthing experience. So and when we're talking about mental health, when we talk about birth, I want everyone to hear that it is a mental, physical, spiritual experience. And so when we talk about mental health and we talk about the social determinants of health and everything that Black women have to do, that affects the birthing experience as well. And so it's something that, you know, when we look at family structures, when we look at food deserts, when we look at you know, the stresses of having to work 2 and 3 jobs, that all affects our birthing experience, and it has affected the Black maternal health crisis. But that's all compiles on to the fact that when we walk into a medical facility, there's already some type of anxiety around being in a medical facility. 1, that's historical. 2, when we walk into a medical facility, we are surrounded by people who typically don't look like us. There are areas in this state, in the state of North Carolina, that are considered maternal health deserts, meaning they don't have the physicians or the staff to support maternal health in general. So just imagine being in one of those areas and you don't see someone like you. So that's compiled on top of that. So what we do as doulas, right, it is our job to arm our families with knowledge on how you can manage your pain. You know, a lot of people didn't know that there's 4 different ways that you can manage your pain in a hospital, with knowledge on different types of births, right? You don't have to go to a hospital. You can go to different facilities. On midwifery, you don't have to have an OBGYN. You can have a midwife. So it is really stepping into that. But the thing that really hit me recently was that when we think about the social determinants of health, we think about socioeconomics, right? So we think that maybe Black women who have a better paying job, that may have have more educations or more access to education would be treated a little bit differently, right? That is not the case. So we're seeing in our Black maternal health crisis, we are seeing Black women who are highly educated, right? Who have a lot of support financially and physically, right? Still dying at a more alarming rates than white women, than Hispanic women. And so when you look at that, you're like, so what is it? Because it's not access, it's something else. It's something inherent. It is not it's not genetic, right? It's not something, oh, Black women, it's not our health. It's not genetic. It is something else. And so some things that I have experienced is that, again, I went through a program called Lived Experience Accessible Doula through UNC, and it's a group of Black women who teach Black women how to be doulas for Black women, right? Look it up if you can. But one of the things that we learned was that, and someone said this, if you're a Black woman and you're in any situation, do not go in that hospital if you have to have someone deliver you some flowers, or if you need to bring some cards and postcards. You don't want to seem like you are in there alone, because that will affect your healthcare and how people will approach you and treat you. And it's like, really, you have to do all of these things just to get some level of care. And I've actually seen that. I've actually witnessed that. I've actually gone into, we also work with incarcerated women, and that level of care is just totally different. So it's mind-boggling that the body that you're in is just not receiving a standard level of care that other people are. And it has nothing to do with socioeconomics. Has nothing to do with anything but your skin color.
I remember a while ago, I don't know, I'm not sure exactly when it was, but I remember Serena Williams was speaking out about some of the issues that she had faced when she was having her first child, maybe. I could be wrong, don't quote me on that one. One of the babies, but she was basically saying how, the treatment that she received wasn't up to par, because and what I assumed is that the people who were providing her healthcare assumed that since she was Serena Williams, she could tolerate a certain level of pain. And I think that goes to show that, it's the biases that come with being a Black person, particularly a Black woman in this scenario. It's never ending, right? So Dana, I want you to talk about.
Well, I was going to say, on top of that, she was telling them exactly what was wrong with her and what she needed. It was coming from her, and they would not listen. Beyonce had some issues as well with her birth. Something very similar. She knew exactly what she needed, but they wouldn't listen.
Dana, I want you to touch on some of the barriers that Black women encounter when accessing healthcare, right? When trying to go to the doctor, trying to find a physician who listens and sees and hears them. What are some of the barriers? You spoke about employment being tied to healthcare, but what are some of the other barriers that you think that are out there from a diversity and equity and inclusive lens?
Yeah, so one is definitely going to be that healthcare. Based on what type of employment you have, how your social economic status is set up, you are going to have the opportunity to have better healthcare. Unfortunately, within our country, everybody does not have equitable access to healthcare. So those who do fall lower on the social economic totem pole unfortunately are not going to have the same access. But then we think about it, and as we talked about Serena Williams and Beyonce, like they have all of the access in the world, right? There's also this barrier, and I've learned this not through my birthing process, but through my challenges with my mental health and ADHD. Black women have to basically become a doctor themselves in order to go into the doctor's office and say, this is what's wrong with me, and this is why. I've had to do so much research each and every time I have an ache, a pain, anything that happens to me, because I know when I go into that doctor's office, I may not be believed, or they may try to brush it off and say, oh, that'll go away. You can handle that. So in a sense, we have to be so well educated on our bodies and what we think it is that we're coming to the table already with diagnosis. And we know in healthcare, we should not be doing that. Like we should.
And I want to really, I think I'm a devil's advocate on that.
Mm-hmm.
Because if we wanted our hair done a certain way, we would investigate the stylist. We would put energy into what type of hair we purchased. Mm-hmm. If we were going to a main event, we would put great length into deciding what we want to put on, et cetera, et cetera. But when it comes to health, and this is not just specific to women, we somehow walk into a room with another human being who has frailties. It's like going into your pastor and thinking that because they have a calling or a theological construct that we can just, that they're capable of giving us everything we need. And what I would challenge us to do, to what Ms. Duckworth is saying, is to kind of turn that around and say, that is exactly what we need to do. Mm-hmm. That's exactly the energy we need to put into healthcare decisions. That is what we call consumer advocacy. That is why we walk into these spaces and allow people to do things to us, mm-hmm. instead of taking full control, because we read about it and we studied it and we wrote down the questions. When I ran an agency and we tested someone positive for HIV, the first lesson they were given was to you no longer go into a physician's office without something to write on. I don't care from the time you make the appointment to the time the procedure occurs, you are to know every single person that you spoke to by name and by number, so that when you have to recall, you can. Not, oh, I just talked to this lady. No, I spoke to this person. From a personal perspective, I've had a knee replacement. I've had partial hysterectomy. I've had laparoscopy. I've had a number of other procedures, and praise God, all of them were considered minor. But I can guarantee you, there was never a procedure I didn't know who I wanted to go to. I told the physician this based on my research, based on talking to other people who've had similar, this is the surgeon that I want, and that's the surgeon I want you to get me.
So Dr. G, let me ask you something. Isn't there or shouldn't there be a certain level of trust there between patient and physician, right? Because
absolutely.
when I go to get on an airplane, right, I have a level of trust that pilot knows what he's doing. He done been to school. Mm-hmm. He know how to navigate this turbulence. He gonna, know, if things get rocky, he know how to do whatever. So,
but see, that's different because you don't have a relationship with him. Your trust is in the fact that he has a skill set to take off and land. This is slightly different. The people that we allow to come into our private space when we talk about healthcare, and this is again my thoughts based on 40 years of dealing with people getting diagnosis. Mm-hmm. It's a relationship. When I test somebody positive, at that moment, I want a relationship. I'm not there to just give you an outcome. And I have to teach you, goal is to teach you how to engage in the relationship. And guess what? One of the things we hate to do, When we see that we're in a relationship with a provider and they're not giving us what we need, we notorious for sticking around, just like a bad lover. You know it's going downhill. You know it's dead in the water, but for whatever reason, you feel you need to stick around and feel the pain. No, get up and go. If that church that you're attending is not edifying who you are as a human being, get up and leave. Tell the physician, I'm leaving you. I thought we had a relationship, but we don't.
Dr. Gaddis's point, to your point, it's also recognizing, because you're in a relationship with that person. You are. I mean, that person is seeing parts of you that nobody else should see. And so it's recognizing when that doctor is off, when maybe you can say, you know what, maybe we need to revisit, because doctors are people, just like ministers are people, and they go to work and they have bad days. And unfortunately, those bad days can have a negative outcome.
And those are the days we say to them, are you having a bad day?
Are you having a bad day?
Are you having a bad day, Doc?
Yes. And it's okay to say that. It's okay to say, maybe not today. I mean, or talk to the nurse. But those are the times where it's removing yourself, but it's recognizing not to go blindly and say, this is my doctor. I trust this person. I've been to this person for 15 years. That doctor may have had something happen to them that day.
But I want to go back to what you said earlier, and it's one of the most important things that I can think of. You said that we should not be alone.
Never. Mm-mm.
We should identify someone up front that we allow in our space to go into these appointments with us. Mm-hmm. And no physician can tell you, you cannot have such and such person in there with you. You are the client. And once you give someone permission. So the fact that you are in as a doula, as a person who's there to advocate, sometimes that advocate is saying to the doctor, I'm not sure what I'm hearing you tell her. Mm-hmm. I'm not sure if I don't understand what you're telling him, then I'm questioning whether my husband or my boyfriend or my child or whatever understands what you're saying. Can you help me understand? Because I'm here as their advocate. It's like sending your kid to school and the teachers don't know they got a mama and a daddy and a grandmama and an uncle or whoever's going to show up and show out if they're not treated well.
Exactly.
They don't want to see you in the place.
And that's the education. Like, we as Black women, we in our community, we have to have the education, like Dr. G said. Like, you have to know who everybody is, what that professional does, and you need to be writing down names, taking notes.
Googling.
I didn't know that when I first started. Like, when I had my children, I'm just like, okay, these people are here to take care of me. Mm-hmm. I trust them. This is what they do for a living. So as someone who was young having their children, no way did I have that information and education. Now, as somebody who's really well versed in, the things that impact our community, when my grandmother goes to the doctor, I'm there. If she's at the hospital, I'm there. They call me the boss because I'm going to ask those questions and talk to that doctor, because sometimes they just do not take us seriously. They don't take our pain seriously, or even the things that we know. Like, I know there's something wrong with my body. It'll go away. No, it won't.
And as an advocate, I, as a person who tries to educate and advocate and be an advocate, I don't speak directly to the doctors. I speak to my clients and I say, did you understand that? Did you understand that? Did you understand what was going on? Do you know what's going to happen next? Do you? And that kind of helps get them present as well. Like, they start feeling empowered at that point to say, oh yeah, I do need to speak for myself, either them or their support. We have to think about birth as a community. And so it's empowering people to speak up for themselves, and it goes beyond this one experience. It will go, like, to your point, with them throughout their medical kind of journey, hopefully.
And to that end, I think some of it has to do with the competence of the person you're with or advocating for. You know, if I'm advocating for someone who may have some formal disability, and they, even in the best case scenario of asking them, do they understand totally what's happening, that you may not be able to penetrate. So sometimes we must be that voice for them. You know, certainly your option is better, you know, when you can pull them to the side and demonstrate and asking them questions about, even saying to them, how would you say this to the doctor? You know, once you present them with information, say to the person, okay, now it's your turn. You feel this certain way. Role play with me and help me, tell me how you would say it in your words, not in mine. And that is also a skills building opportunity. But one of the people in the chat talked about access to healthcare or lack thereof. I think they have their own unique challenges. When you live in a rural community where, as you said, there are physician deserts, outside of not having access to internet, which is also a critical part of living in desperate areas. Outside of that, I would ask that, is there a library in the community? Someplace where I can get access to the broadband system. We look up everything else. Beyonce's coming. What's the date? Beyonce's going to be here. You know, I don't know what people's favorite.
Beyonce, Dr. G. Wait a minute.
I mean, I mean, personally,
it's
I would be more likely
that's a fair
to look
comparison.
Say what?
I don't think that's a fair comparison. It's Beyonce.
Well, I'm not a Beyonce. I mean, I love Beyonce, but that's not something I spend my money on. I'm more likely to go jazz.
I'm a card-carrying member of the Beehive. I just want to let that be known.
Hey, and I'm with you. I understand why you like that. But all I'm saying is we can find any information we want to find when we want to find it. So we cannot step back, and in the case of access, other than are the unique situations that happen, like I don't have insurance. You get treated a whole lot different with insurance than you do with no insurance. You wait a lot less when you have insurance than when you don't have insurance. And there's no way we can get around that bias. That's why, back to Ms. McIntyre's acknowledgement, we should never be alone. We should always have an advocate. And there's a lot of women giving birth who don't have an advocate other than their mama, maybe.
I want to talk about the DEI lens a little bit more with Dana, because I feel like we are seeing diversity, equity, and inclusion in a lot of spaces now, particularly in corporate America. There are, like DEI departments, and, in the wake of George Floyd, we saw all of the corporations where we stand in solidarity with you. And, a lot of those things are cool. And a lot of them are, they're on point. Some folks are, but what are some of the strategies that you think the healthcare industry can borrow from corporations and companies that are doing DEI correctly, and how can they implement it into the fabric of who they are, to be sure that they are treating their patients with a lens that is equitable to everyone who comes into those hospitals?
So first, you're going to get me on my soapbox by saying that a lot of these organizations now have the DEI committees and councils post George Floyd. Well, employment for DEI practitioners was up about 120% post George Floyd. That number has since decreased drastically. So we're seeing that our roles, particularly Black women in our roles, are no longer in those roles. We're being phased out. So it was kind of a trend, and we had all this lip service, and we were standing with this, and we wanted to do that, and we were driving these initiatives. And now the new thing is, we're only focused on tech. We're thinking about ChatGPT. We're focused on AI. So there are some companies that are still still doing it really, really well, but we have to be realistic in knowing that, hey, that was a time and that was a moment. And some of the things that they said, they're not actually walking and talking by. I have consulting calls with companies that want things for the appearance only. And if you're in the healthcare field, you cannot afford to be doing anything DEI for appearance only, because you are playing with people's lives and their livelihood. So you really have to create systems, create processes from day one. When somebody is coming into your organization, as someone that's hired, like, what is your practice when it comes to bias? What are your steps when you're onboarding someone? Are you talking to them about, hey, this is the culture of our organization. This is the type of transparency that we require. This is the type of advocacy that we want to see come from you through your patients. You have to set the tone within organizations from day one. And that starts with recruiting. Like, are we recruiting enough Black doctors? Are we looking at HBCUs? Are we looking at untapped markets to make sure that we're fulfilling our institutions with people who maybe have walked the same walk of life as the patients that they're serving? Like, I want my doctor's office to be reminiscent of places that I feel comfortable, where I feel welcome, where I feel seen. I want to know that if I say something that's not, that is in AAVE, like, they understand my vernacular when I'm saying, hey, it wasn't feeling right and I couldn't shake it. Do you understand that? Or do you need me to give it to you in another term? So I think those are some things that they can think about as organizations. And then for me, a lot of times in corporate spaces, it really starts, it's employee-led. So you have employees, you have diverse employees, more than likely. We need to be talking about their healthcare experiences. So that's when your surveys start to come in, your research. You have the data points right there, but are you creating that dialogue within your organizations to know that, hey, Sheila, who I really, really like, is a Black woman in my office. I've never talked to her about her birthing experience and how that could have potentially been better for her. Personal touch is a great way to figure out how you can do things better.
I have a quick question, if I may. Is there concern now with the new Supreme Court affirmative action ruling that we'll lose a lot of that? I mean, it's already difficult to recruit Black and brown people. It's already difficult to retain Black and brown people because, as we know in this group, DEI for a lot of people is very surface. We put out the statements, we have it on the websites, we have a diverse culture, but we don't support those people. So we're not retaining them because they're having a difficult time with how we operate. So now we are in this sphere, right, where we have this Supreme Court ruling. Is there some concern in your work that we're going backwards rapidly?
So there is some concern. Of course, the affirmative action, that's more for institutions of higher education, but there is concern, and there's kind of this like war on DEI. What's okay to say, what's not okay to say? How can you tailor programs to one group and not the other? So they are starting to mirror each other, and people are starting to kind of change their tune on, maybe we don't need to have an employee resource group for just Black people because maybe there could be some ramifications for that. So it is starting to mirror in corporate America what we're seeing happening in legislation, unfortunately.
One of the things, I'm a firm believer in charity starts at home, which also in this case means that we need to do self-examination. I think there's a need for some diversity, equity, inclusion training in our own community, that we as we talk about what the broader society is doing to persecute or not to support us, we have just as much detrimental behaviors, prejudices, biases, and attempts to basically assassinate the spirits of our own people right in our own community. And so we need to look at, what does diversity look like when you talk about you're a Black physician and a trans male who is pregnant presents in your practice? Are you able to look past your religious doctrine, or are you going to take the new Supreme Court way out and say, I'm not touching this person. I don't want to serve this person because they are against my spiritual beliefs or my religious doctrine. We have to confront it first. Our propensity is to say that broader community is not supporting us. How we greet people coming into our agencies. Can imagine what your profession would be like if you had a doula who was insensitive. I mean, yes, you go through training, but training does not impact the spirit of somebody. And like children and dogs, because I got all of that around me, they can see through all of the whatever. They know whether to growl or stay away from you. And I just think we need to really look at self first. What is it that we can do in our institutions? We talk about HBCUs. Is that not an ideal place to teach and train people how to address some of these disparities? We talk about the Black church. What better place to talk about the Black church? What better place to talk about pregnancy and talk about reproduction and talk about sexual health and prevention than the Black church? Mm-hmm. If it's about love, but we're not always espousing those things because we're too busy judging and being hypocritical. So we need doulas, to people who will support folks who cannot get support in places where they should be able to get it naturally, even in their own households.
You would,
so let me ask
be,
this.
Oh, I'm sorry. You would be surprised in what a doula has to have, how we have to work with families.
Especially when it's unwanted, when the baby is coming forth in the family or whoever is not supportive of the birth of that child. I can't imagine what you must see.
It's the support of but want to be there because they said they were there. Oh, and the live streams. I mean, y'all just put the phone down. Like, this is not the time or the place to go live.
Live streams of births? Live streams of births? Is that what you're saying?
We've had to tell them, put the phone down. You don't go live in the hospital.
Like Erykah Badu.
Yeah.
Wow. So we press for time. I got a couple more questions because Dr. G got a hot date. So let me ask this first to Deidre and then to Dana. What does a holistic, culturally responsive approach to healthcare for Black women look like?
I think it's one based on pragmatism, understanding that not everybody is going to support you. So it is being very real with yourself and who you are and who you are choosing to be in your village. I think that's a very hard thing for Black women to do. I think we always elevate certain people in our lives as our support, and they don't necessarily need to be there. So that's one thing.
You said they don't deserve it.
They don't. No, we elevate certain people to be our support, and they don't deserve it. This is my body, so I should be able to say who deserves, right? Who am I entrusting? If I pass out right now, who am I entrusting with my body, right? Who deserves that?
Well, do you have a written plan for who's supposed to be that person?
You have a written plan. You have a verbal plan, and and even in births, everybody in that room needs to have a job, right? If someone is coming to support you with surgeries or after birth, everybody in that room needs to have a job. But it's based on pragmatism. It's truthfulness. It's being truthful with yourself, and that's why it's important to have maybe an outside person help you with that process, right?
Would that be you?
A doula does that in the birthing situation. Yeah, and postpartum as well. We help people come up with postpartum plans. But to get back to the question at hand, it's coming up with something that's based on truth and pragmatism and acknowledging, right, that not everybody, right, is equipped to be your advocate. And then it's acknowledging that there is some point where you do have to let go, right? You have to, that's when your faith walks in, and you have to let go. You've done your planning, you've done your research, You've done what you can, and now you just have to walk in faith. There's nothing else you can do. And that is getting your mental, really working on mindfulness, working on your mental state as you walk into that hospital. And again, my experience is around birth, right? So ensuring, okay, at this point where now my body is equipped mentally, physically, spiritually, I have my support. Now let's go do the thing. And that can be in whatever you do. In healthcare. And then, but the reason why I stepped back and the reason why I got into this is because we don't sue people enough. We don't have malpractice enough. There are certain races that walk into a hospital and they know I'm not going to mess with that person because they're going to sue me. And we don't do that. So
I said that would be me.
Yeah, and be honest, Dion, and in a perfect world, there would be some type of consortium. There's be some type of, I don't know, support around people who need to sue, to have malpractice. That way, okay, you don't like my skin color, you don't like that I'm a woman, you don't like my sexuality, fine. You think when I walk into a room, I'm gonna sue you because it's happened so many times before with people who look like me. So it's all about the capital part. So, I mean, that is not, it's as pragmatic as as everything else I've said, but in a perfect world, I would say, let's come up with some type of GoFundMe. I don't know, something to where people who
no GoFundMe. It will not be a GoFundMe.
No GoFundMe, but who have gone through a health crisis, and they know that they were mistreated, right? Mm-hmm. But they don't have the funds, the time, or the resources to sue.
Mm-hmm. Dana?
Yeah, so for me, it starts with the education. So in a real life sense, like sexual health and education, we know we have it in our school systems, but it'd be so much well-versed. Like, I didn't know the questions to ask when I was going in to have my children.
They don't have the proper education in the schools, FYI.
Correct. So we need to have that access to what questions am I supposed to ask? And then even finding doctors who look like me. I had a time finding a therapist when my other one went away. So just knowing where can I find a practitioner who looks like me, who will understand me, who understands my walk. Like there are some websites, but just having that information more readily available to Black women so that I don't want to feel like I'm going to war every time I'm going to the doctor. I want to be able to take off that armor. I don't want to feel like I had to do 7 days of research just to be able to go in and say, I don't feel good and I need you to help me. I need your help. So just being able to take off that armor, especially if somebody already has anxiety, depression, ADHD, I'm already wound up. And now I'm coming into your space and I'm thinking that I'm coming to a place for assistance and help. And you can't see me. You can't see me. And then what happens from there? Now I need to find somebody else. So I need to talk to my therapist. So it's really a cycle of continued abuse that we'll face in these systems because they're not set up to take care of us. So do we need to set up systems ourselves that take care of us? Ideally, maybe that would be perfect, but I think we have a lot to do. I think the more Black women have conversations like this, and our vocal was saying, hey, I went to that doctor and it did not feel right, girl. I would not suggest that you go there. Or like she said, it's time to sue. We know others are quick to throw that word out there. So I think we have to arm ourselves with more education and more reaction when the things that we know are supposed to be taking place are not taking place. Like we might have to cause a ruckus.
Okay. Final question, and this is a question that actually just came to me as I was listening to all of you speak. It dawned on me that I come into this conversation from a position of privilege, right? Because I've never had a doctor who didn't at least exhibit to me that they didn't believe me when I said this is what it was or this is what I was feeling. So my position in this conversation is definitely one that has been of privilege for the last 40 plus years. So I think one of the questions that needs to be addressed is that is how can Black men help with this situation, right? Because I think so often we have these conversations and it's either this or that, it's us or them, it's we are 50-50 on dates, and we have those types of conversations, and who should pay the rent, and who and all of those conversations, but we don't have the conversations about this and how we as Black men can assist. Because I tell you, it's only a Black woman that's going to ever see me personally, right? So as a Black man, I have to be able to say specifically, like, to my wife, like, who, like, what's up with your doctor, like, who you seeing, like I need to know what's going on, what's happening. But from y'all's perspective, how can we help, and what can we do?
Doing just that. I mean, I will say, in the births that I have experienced, the partner was there as to help and as a very vocal part of the experience. I think it's unique in our community, in that a lot of our support are our mothers or sisters or other women, but there are groups who are advocating and training men in assisting with breastfeeding and destigmatizing breastfeeding. I mean, that's something that that needs, but really being a part of the journey. I think a lot of times we think, okay, a woman gets pregnant. No, it took two people to get you there.
And to the tango.
To the tango. Y'all went half on the baby. I think really stepping into that and saying, I'm here as a support. But also there's a part of it's okay to not know, and it's okay to ask questions as well. You don't have to know everything, and you can ask questions as well. I said my birthing experiences were okay. Now that I've experienced them, I would say okay. When I was going through them, I thought they were good, but that's because my partner, my husband, he asks a lot of questions. And he asked those questions about what type of doctor are you seeing? Who is that doctor? What type of, those were questions I wasn't really thinking about, but he kind of asked those. But if you have questions, it's okay to ask them. As a doula, we really work with partners in training them on how to support the birthing person physically. Sometimes it's, keeping that mouth shut, keeping things calm, but really just stepping up and not shying away from something that you don't know about, doing the research, stepping in, making suggestions, making sure that your partner has a doula.
Flipping some tables over if you got to. Sometimes you got to flip a table over so they know it's real. You feel me?
You flip a table over. Seriously.
Yeah.
Say no. You're not going to do that. And okay.
I had a friend go through surgery, and it was on her hand, and she could feel the pain. And one of the traumas that she still talks about is she allowed it to continue. That she did not say to him, either you stop, you will stop. You will stop right now. And even as we reflect occasionally on that experience, she's still traumatized. But the biggest trauma is that she did not speak up for herself. And so, that's part of the closing of this. I think that we can blame the outside, but so much. But one of the things we must do in this era, with them trying to take away all of our rights and privileges that we work so hard to acquire, is we have to speak up. We can't be passive anymore. We have to be there for someone else who can't speak up. Be there for somebody who can't speak up. We know if they need our help, we say, I will go with you. I don't have to say anything, but I will be there with you. And our presence together is going to tell this individual that we're not playing, that we are serious. I support this person, and I have their best interests in mind.
And I will flip everything over in this office if I need to.
And I will do whatever is required.
Flipping tables is what's required sometimes. All right, we got to get out of here. Dr. G got a hot date. Dana Duckworth, tell them how they can follow you. Tell them how they can find you and all the things. Followed by Deidre. See, Dr. G, she leaving. She gone. She going on a hot date. Dana Duckworth, then Deidre, and then hopefully Dr. G will reappear before she got to go.
Yes, LinkedIn and Facebook, Dana Duckworth, the Black one. On Instagram, TikTok, and all of the other social media platforms, I am Speak Up Dana. You can follow me there. You can visit me at speakupdana.com, email me at speakupdana@gmail.com, and please comment, like, subscribe to my podcast, The Hilariously Unemployed, available to you on YouTube, Apple, Spotify, wherever you get your podcast on.
Big speaker. Deidre, what you got for him?
Mine's real quick. I don't have much on social media, so
okay.
So
well,
how does somebody find you?
In your doula
How do they
service,
find
how can
you?
they find
do
you
a
now?
Google search. Deidre McIntyre, I
goodness.
guess.
Okay,
Yes.
Mr. Chavis, you're gonna have to work with Miss McIntyre.
Yeah,
Her
we gonna
gifts
get her
are
right.
being
We gonna get her right.
underutilized.
We gonna get her right. She gonna be the biggest doula out here in a couple of months. We gonna work on that. All right, Dr. G, what you got? Close us out.
All I have to say is it was a pleasure meeting you all. I hope this is not the last time we have an opportunity to meet. On behalf of the HIV Clinical Trials Network, we're grateful to have this opportunity because this is about education. And it's not just about HIV, but we're really wanting people to broaden their minds that all of these things are intersectional, that there's a circuitry that you can't help do one thing without doing it on the other. So thank you for bringing your expertise as mothers, as providers, as corporate representatives to this space.
Cool. Thank you, Dr. G. Don't forget, like, share, subscribe to the podcast. You know how I say it as I close out each and every episode. Take care of your kids. Take care of each other. But most importantly, be sure to take care of yourselves. We'll holler at y'all on the next episode of Black People Parenting, y'all. Peace.